Dr. Bill Hennessey worked as a board-certified physical medicine and rehabilitation physician for 25 years. Now, Bill, you got out of that. You didn't like all of the tactics that health insurance companies use to avoid giving care to patients. You just got tired of messing with it, true?
It's very true. Four-word definition of an insurance company: collect premium, deny payment.
Yeah. And the tactics that these insurance companies use, we've been talking about them, but they use to delay and deny claims is one, requiring prior authorization. They may deny if it's not medically necessary, confusing the policyholder with fine print, requesting unnecessary or excessive information, repeatedly assigning new claims adjusters, and then finding some little error that was not right, and so you got to start all over again. It's like putting them in a maze where there's just no way out. You had to deal with it as a caregiver, provider. Patients had to deal with it as patients. It can be overwhelming sometimes. I mean, Kay and Angela have both faced it and dealt with it. You've come up with a way to help patients navigate this. Tell us about that.
Yeah, so if we look at what the industry is doing on purpose, they want all of us as patients to be frustrated and confused. Those are the two words. They want, therefore, us to be left feeling hopeless and helpless. Therefore, we open up our wallets and they don't have to pay. So when the average family of four is paying $2,500 a month for health insurance, plus a $6,000 per person deductible, the insurance companies, that isn't just revenue, that's 100% profit just about all the time. And so I've owned a physician billing company, I've founded a price transparency company, and then an advocacy company so we can do it all. And over time, I've figured out how to get people the care they deserve, either through insurance or, in Kay's case, we don't know what the real price of care should have been. She paid $50,000, maybe it was only worth $22,000, for example. So my company, Care Guide, is putting the care back into healthcare, where we are helping people know where to go and what to pay ahead of time, or we're resolving high-cost hospital bills afterward, and we do help with these insurance denials.
You say that federal law requires insurance companies to publish pricing information. Pricing for what? What do they have to disclose?
Both health insurance companies, commonly known as Blue Shield, United, Cigna, and Aetna, as well as 5,700 hospitals in this country, are supposed to publish pricing. They don't, except for cheap stuff. The more expensive the care, for example, cardiology or oncology, they deep six it. And that's on purpose. They don't want the public to see it. They want to have their competition see it. And no one's putting them in check. But it is under the direction of Health and Human Services, HHS, where if laws were enforced on the book for price transparency mandates, we would get to a point where we can separate care from insurance and have pricing known. But as long as they're getting away without any fines or jail time, trust me, the illegal return on investment's higher for the insurance companies and hospitals. They're going to keep going to get away with it.
Okay, we got to take a quick break, but I got an important question for you when we come back. Bill says that denials can be overturned by submitting a different diagnosis or billing code, which highlights the complexity of the system. And then I've got a question that I think is really interesting. At least I think it's interesting when we come back. Well, we're back, and I have a question for Dr. Hennessey, and it goes along the lines of what you're saying, because I've been in the healthcare delivery system, and you're exactly right. Sometimes I could change a diagnosis, which either one could apply. One would allow for a whole lot more coverage than another, and both of them aptly fit, and you just have to see which peg goes in which hole. But I've seen with hospitals that somebody would get a hospital bill and it might be $110,000, and they can go into the administrator or the billing people and say, well, look, I don't have insurance. And the bill would be $110,000 if they had insurance and $17,000 if they don't have insurance. Now, how do they get away with charging 8 or 10x if you have insurance and a more reasonable price if you don't?
Right. So you're punished for having insurance. Great statement, Dr. Phil. So I want you to think of the hospital as a castle. It has a moat around it. And there are 4 alligators in that moat. And their names are Blue Shield, United, Cigna, and Aetna. You have to do business with them to get to the castle. So they collude to make profit. The stock shareholders of the 4 publicly traded insurance companies need the price of care to go up because under the Affordable Care Act, you're allowed to keep 20% for admin and profit. 80% must be spent on clinical. So it becomes painfully obvious that it's better to have 20% of $200 billion instead of 20% of $100 billion. So there's plenty of collusion to say, aha, this person has insurance. Let's play the billing coding game and make sure we get to both make more money.
Yeah. And if I don't have insurance, then look, here, just give me this and get out of the way because I got much bigger fish to fry.
That's true. But listen, I want everybody watching to understand under the Affordable Care Act, there is one silver lining. It's called IRS 501R. Nonprofit hospitals have to give back free and discounted care. That's to people making more money than Medicaid, but not enough for an overpriced publicly traded carrier plan. So 100 million people, in my estimation, qualify for free or discounted care. So always speak to the financial counselor of the hospital. So for example, family of 3 making $53,000 or less, it's free care.
Wow. Unbelievable. We'll be right back. We reached out to Angela and Kay's insurance companies for comments, and Angela's health insurance, Blue Cross Blue Shield of Illinois, did not respond to our producers, but made this public statement in regard to her husband's case. Quote, "We are committed to increasing access to safe, appropriate, and effective health care based on the best available information and research." End quote. Kay's health insurance company, Cigna, made the following statement. "When patients face illness, they look to us to help them during a difficult and vulnerable time. We strive to do our best to ensure that each person gets the appropriate care as quickly and easily as possible. We fell short for Miss Sue. We have discussed this with her and apologized for how we handled her care. We take our responsibility to patients seriously, and we always work to improve how we support them." End quote. Well, there you have it. We're unfortunately out of time, and I want to thank Angela, Kay, Brigham, and Dr. Hennessey for joining us. And Dr. Hennessey has some tools you can use, and with his permission, I'm going to put links to all of that on our website here at drphil.com and on merittv.com. So you can go there and click on the link and get to his site, which can help you navigate. I suspect save you a lot of money and a lot of heartache. And thanks to you at home for finding us here at Merit TV. We will have even more information about tonight's show, as I say, on our website. So make sure to log on to drphil.com. All of you guys, thank you for sharing your stories. I think it will touch a lot of people's lives. I wish you nothing but the best. Good night and goodbye. Thank you.